Doctors of Reddit, what's your thank God they came in for a second opinion moment? If you enjoyed this video, please give it a like and subscribe for more. Psychiatrist here. A 30-year-old man with mild depressive symptoms was in and out of the hospital fairly quickly. He was under pressure from his home life, living with 4 roommates who were making life a bit difficult for him. No suicidal thoughts. He was cleared of all psychopathologies by me and 2 other doctors. A few months later he came back. Same symptoms, however this time he talked about 5 roommates. It felt wrong, and I digged in his story. Tried to contact his roommates. He lived alone and was severely psychotic. I have no idea to this day how he hid it so well from everyone. 22-year guy came in after seeing his primary at another hospital. His mom was my patient and asked if I would see him. I am an internal med doc. He had told his doctor he had a headache. I did a usual full review of symptoms since he was new, and he also marked his left testicle had a lump. Did exam and he had hard small lump on testicle. Knew right away likely had metastatic testicular cancer. 1 stat brain scan and testicular ultrasound later confirmed it. Asked him if told other doctor about the lump and he said yes, but the other doctor told him it was normal. Edit, he lived by the way, but it was close a few times. So fellows, if you note a lump on your testicle, ask for an ultrasound and don't be embarrassed to bring it up. Edit 2, for those of you who are concerned after examining yourself, there is a small soft area posteriorly that should be similar on both your testicles known as the epididymis. That is normal. A hard lump on only one side only is not. Monthly self-checks between ages 15 to 34 can be done, but since rare 5/100,000ths, not a general recommendation. This guy was told he had pink eye. He had metal shards in his eye from welding. My grandmother had her hip replaced, but the hip always hurt to her. She waited a year, hoping it would go away, but it never did. She asked multiple doctors and did multiple x-rays, but doctors said the replaced hip was fine. We finally made her go to a private clinic in my hometown, and the doctor saw that the replaced hip was fine and dandy, but the bone around it looked like it was a tad bit eaten by bacteria, so the new doc did an operation, and there was so much pus in the leg it was insane. If my grandmother waited any longer, her blood would become infected and she would have died. Thank goodness she went to the clinic. I had a guy come in for a second opinion after the first place didn't bother asking any medical history. Of course I took his history and asked more questions as we went. I remember telling him something felt off and we needed to run a test. So I ordered a peripheral vision test. When I got the test back I was shocked by the most classic tumor pattern I'd ever seen. 2 weeks later he was in surgery to get it removed. A month after this guy was back in my clinic thanking me. Totally different guy. Personality was a complete 180, energetic and happy. Edit, here's another one I thought of though a bit more sad. But also good at the same time. Here's a cautionary tale why urgent cares should never treat eye issues. Lady was referred to me after 2 weeks of treated for a red painful eye. The PA and MDs that saw her tried allergy meds and antibiotic is thinking it was allergic or bacterial conjunctivitis, or hoping it was mild viral that would resolve on its own, so I took one look at her and knew it was a herpes simplex infection in her cornea. She was in pain and had been mistreated for 2 weeks. Got her on antivirals, but after discussing how it was odd she didn't have any active herpetic sores, but had a really bad cough that the said was just pneumonia and would go away with antibiotics, I told her to get it checked with a pulmonologist because it didn't sound like pneumonia and it wasn't getting better. I saw her 3 months later to monitor her corneal appearance and she came in using a wheelchair. Turns out the pulmonologist was blown away that the had dismissed her. She had a really rare small cell lung cancer. The reason the herpes infection manifested in the first place was her immune system was compromised. She told me the pulmonologist said I'd saved her life because they caught it early. It's been a bit over a year. She's still undergoing treatment but her spirits are strong and she's optimistic, as is the pulmonologist. Bit of a weird one, because the request for a second opinion came from an intensivist and I was a contributor to their treatment plan. I work in poisons control. Had a call from a green, but very astute young doctor with a middle-aged female patient presenting with a vague 36 to 48 hours history of malaise, confusion, hypoxia from hyperventilation, and hallucinations. On workup was noted to have pulmonary edema, lung fluid buildup, metabolic acidosis, acute kidney injury, sinus tachy and raised CRP and WCC, suggestive of infection but no temperature. The initial diagnosis was sepsis. This keen-eyed doctor, pretty fresh out of med school, decided to do a salicylate level on this lady because the hyperventilation paired with metabolic acidosis and ACI was enough to prompt her suspicions of aspirin poisoning, even though they could just as easily be explained by sepsis as well. The level came back high. Not huge, but high, which prompted her to phone me for a second opinion on how relevant the finding was in terms of the patient's clinical picture. Simultaneously, the patient's family investigated the property and located numerous aspirin blister packs suggesting she had been dosing herself for chronic pain, which was present in the medical history. Chronic salicylate poisoning is insidious and has been referred to as a pseudosepsis in the medical literature as it often causes similar features. Comparing a high level in chronic poisoning to the same level in acute poisoning, features are much more severe in chronic poisoning, i.e. pulmonary edema, hypoxia, ACI etc. There is a disparity. We recommended certain treatments, all hail sodium bicarbonate, and the patient made a full recovery after a 2-week hospital stay. Whilst there was no question an infective cause was present and contributory, I was impressed with the green doctor's intuition and willingness to consider other causes. I feel like it greatly improved the patient's treatment. Edit some words. This is a "I wish I had gotten a second opinion" story. I had a doctor in high school who was unconcerned when I suddenly developed vertical double vision, which was freaking out everyone in emergency, where I had gone initially, and lost 60 pounds for no reason. It was only a year or two later when I told him that my arm would fall asleep much faster than normal when I raised it to ask a question in class that he thought there might be something wrong with me. MRI ordered. Brain tumor found. Dermatologist here. I have seen probably 5 instances of my other doctor told me it was fine, that were melanomas. A lot of times people don't want a full skin exams. There are lots of perfectly sane reasons for this: time, perceived cost, history of personal trauma. However, I routinely find cancers people don't know they have. Keep this in mind if you see a dermatologist for acne and they recommend you get in a gown. Had a patient come in for therapy after his PCM yelled at him for being a hypochondriac and saying his symptoms were all in his head and that he was just trying to fish for disability. His symptoms were pretty obviously neurological, so I referred him for an MRI. To my shock, he had only ever had X-rays. Sadly, I had to tell the 19-year-old man that he had multiple sclerosis. With great satisfaction I got to tell that PCM he done goofed and that I would be talking to our mutual chief of clinical services about the incident. Nurse here. Had a lady in for simple pneumonia. Her 13-year-old son was getting bored, so I showed him some equipment. I connected a simple heart monitor to him and discovered he was in a complete heart block. I printed a strip and showed it to the doc. We suddenly and unexpectedly got a cardiac patient. One of my sister's friends was diagnosed with cancer at age 10. They were advised to pack up their stuff and move across the country to go to a specialist because they would have to stay there for at least a year. They even had to hire a private plane so she wouldn't get sick on the plane from any passengers. Well, before they left they got a second opinion saying it was pneumonia. Then they got a third that again said it was pneumonia. Now several years later she is healthy and never got cancer treatment and has been tested for cancer regularly. Not a doctor, but the patient. Went to my family doctor with the worst headache of my entire life. She dismissed it, telling me it was a tension headache and that I should take a Tylenol and lay down in a dark room. Over the course of the next month, I saw her a total of 13 times, each time with worsening symptoms. First it was dizziness, then vomiting, then eventually I could no longer see out of my right eye. Every time she told me it was just a tension headache or a weird migraine, gave me a prescription for painkillers and sent me on my way. The final straw was when I was no longer able to walk properly. I would try to take a step, but all I could manage was this weird shuffle. She reluctantly agreed to send me to a neurologist. The next day I showed up at his office and was in there for less than a minute. He took one look in my eyes and immediately called an ambulance. Turns out I had hydrocephalus. My ventricles were 5x the size they were supposed to be, and my brain was literally being squeezed out of my head. Go figure. Thanks for watching. Please leave a like and subscribe for more content.